what untreated OCD really does to your mental health. When people hear the term OCD, they usually think of someone who's obsessed with cleanliness or who needs everything arranged in a certain way. And while that's part of the story, OCD, Obsessive-Compulsive Disorder, is much more than that. It's not just about habits. It's about distressing, intrusive thoughts and overwhelming compulsions that can take over your mind day after day. And when OCD goes untreated, it doesn't just stay the same, it gets worse. Untreated OCD often begins subtly. You might start doubting things. Did I lock the door? Did I turn the stove off? You check once, then again and again. Even when logic says everything is fine, your brain keeps whispering, what if? Over time, this loop of obsession followed by compulsion starts to take up more space in your day. You might spend hours checking, cleaning, counting, or even ruminating about things that haven't happened and may never happen. One of the hardest parts? OCD can hide in plain sight. From the outside, you might look completely fine, working, studying, socializing, but inside, your mind feels like it's running a marathon. Intrusive thoughts invade your peace. These can be violent, sexual, blasphemous, or deeply personal. You don't want them, but they keep coming back. You try to neutralize them with rituals, prayers, counting, or mental arguments, but the relief never lasts for long. Eventually, OCD begins to affect your relationships. You might avoid people you love because you're afraid of your thoughts or behaviors around them. You may isolate yourself out of guilt, fear, or shame. The more isolated you become, the louder OCD feels. This isolation can even lead to depression, anxiety disorders, or panic attacks. In severe cases, untreated OCD has been linked with substance use, suicidal thoughts, and extreme burnout. You are not your thoughts. If this sounds familiar, there's something important you need to hear. You are not your thoughts. OCD doesn't define who you are, it's something you're experiencing. And you don't have to go through it alone. The good news? OCD is treatable. Many people with OCD benefit from a type of therapy called CBT, or cognitive behavioral therapy. A specific technique called exposure and response prevention, or ERP, is especially effective. Medication, like SSRIs, can also help by reducing the intensity of intrusive thoughts. But most importantly, reaching out for help is the first step. The earlier OCD is recognized and addressed, the easier it becomes to manage. You don't have to wait until it controls your life. With the right support, you can reclaim your time, your peace of mind, and your relationships. You can go from just surviving to living again. OCD is real and so is hope. If you think you or someone you love might be struggling with OCD, talk to a mental health professional. The road to healing isn't always easy, but it is possible, and it starts with understanding. Thanks for watching Mind Health and You. If this video helped you, please like, subscribe, and share it with someone who might need it. And remember, mental health matters. And so do you.